Okay? Same conversation. Flip-flop, the woman's over there. This is the man. This is research tells you. Happy. Sad. Angry. Fear. Desire. Men that are in nurturing occupations do match that of women in terms of expressiveness on their face.
Which means that that expressiveness is not an innate gender trait. It is a learned social skill. And that women are just better at that particular skill than men are. So right now I'm going to give you an example of a mixed message.
And we want you to fix it. Tell him exactly what he needs to do. Go ahead.
I'm very excited about being here.
All right, what does he need to do?
Well, I'm saying I'm very excited about being here. Do you believe me? No. Why? But I said I'm very excited about being here. I'm very excited about being here. I'm very excited about being here. Very, very, very excited. Very excited about being here. Very excited about being here. Very excited about being here. Oh, the muscles in my face. Very excited about being here.
Animate your arms.
Very excited about being here.
Young Frankenstein. Anyone remember that? The monster? Right. There you go.
I'm very excited about being here. The fact of the matter is that there's about 1 million things that you can fix. And every little thing that's out of whack contributes to a mixed message.
Years and years and years, people that have trained leaders to be expressive in their voice. What do they say? When we said, how should we do it? They said, read stories. Because you get to learn so much about how the voice is used by reading children's stories.
Meanwhile, 3 little pigs just went out the door for a walk.
Aaron, this isn't the story that I'm used
to
hearing.
Different story.
Oh my God.
The elk stopped to graze near the front door of one of those little pigs. I quietly snuck up on the elk and waited patiently like my mommy and daddy taught me to. Just as I was about to bite into the elk made a fast move and sprinted away.
Oh my God.
Then the pig somewhat ran out. Okay.
Could be worse. You could have a camera on you. The entire class could be watching you. Classical training in communication for medicine is role modeling, which is, okay, find somebody who's good at it, watch them, try and figure out what it is they're doing, and emulate them as best you can. And then maybe, if they're really lucky, they get some sort of simulation, and then they get debriefed afterwards. Well, it's a ludicrous way to teach a skill-based thing. So for instance, if you were to teach someone to scuba dive in this way, this is how you do it. Okay, I'm going to put on my scuba gear, and I'm going to swim. Ready? Watch me. You go, and you swim, and you come back up, and you say, all right, did you see that? Now you put on all my gear, and then you shove them in the water, and then you pull them half breathing, half alive out of it, and you tell them all the things that they did wrong. And then you do it again and again and again. Well, it's ludicrous. It's a ludicrous way to teach. But because there aren't these sort of broken down skills in medicine, this is the way they're forced to teach. So what we do is, as in scuba diving, you say, okay, here's how you put on your mask. Here's how you put on the oxygen. Here is how you breathe. Here is how you submerge. Here's how you swim. These might be good skills to know beforehand. And then, and only then, go into a simulation so that when you come out and you get some feedback, you're able to say, all right, well, the swimming was good, the breathing was good, you ran into a wall. So now let's do all the other things well, but let's not run into that wall this time.
The surgeons are working in a very high stress environment, making decisions right away. And as a matter of fact, pretty much every single day, they're dealing with life and death situations. They know how much communication means, and they know how important it is. So they are able to grasp what we actually are sharing with them and put it into practice right away.
Well, I had a friend who had a similar surgery, and it's like all sorts of bad stuff happened to him. He was like, I saw him in the hospital, and he was all lying open, and he was lying there, and he had this big open thing, and his, you could see inside, and they had like this saran wrap or something over him, and it was like that for, it seemed like months. Okay. And then he had this just this really ugly scar. It looked like a mouth.
So you're concerned that something like that might happen to you? Is
Yeah,
that
a little bit.
Okay. Well, that's usually not the way that these procedures go. This is something that's very common to have done. Lots of people have trouble with their gallbladder, and it sounds like this was something that didn't go as planned. That's why we do this meeting before we go to the surgery, so that we can talk about the way things may happen, and talk about the risks and benefits of the procedure, and let you know of some possible outcomes. Okay. Also, to kind of reassure you that although that was something you might have seen, it's probably not the way things will happen for you.
But so, for instance, this morning, we taught a group of 17 surgeons, and the response was overwhelmingly positive. And so, one of our goals initially is to make sure that that we are able to show immediate applicability of this works. We're very conscious of the time constraints these doctors are under.
We are all overworked right now. We live in a world that believes that multitasking is sort of everything.
But there's an important detail. Melissa's been up all night, and this is a real thing. Melissa's been working all night long. And so, I think our perceptions are certainly altered, and our patience for our patients is dramatically dissipated when we're exhausted.
I think
and
you're absolutely
you're
right.
much less likely to smile and engage. You're sort of like, Jesus, what's wrong? Let's just fix it and move. Let's go. I'm tired.
What is it? All right, fine.
So what do we do in that?
I think it's certainly something that we'll all struggle with our whole career, is trying to maintain our,
How do you
compensate when you're exhausted?
How do you compensate when you're exhausted? Now, the problem is, in medical school today, there is so much stuff to learn. Medicine has come so far that there's only so much time to teach things. So what has fallen by the wayside is how to are the skills of communicating with another person. They've just fallen out of the medical curriculum. Because you can empathize with anybody, but there are some people that you don't want to empathize with, or there are moments when you're just not up to putting the energy. And it's important to recognize the difference between I can't empathize and I won't empathize. We all know that empathizing with another person is a good thing in terms of the medical experience, but it takes energy to do that. And there are sometimes, even in our relationships with other people, with our parents, with our friends, you know that you should have a certain type of conversation, but maybe you just don't have the energy to do that right away.
I know that I loved everything about the body, and it was just amazing. That part of it was just like, I felt sort of obsessed about reading about every case that I was going into, and sort of in contrast, more so than any other rotation.
Wow.
Okay, you know what? Let's go ahead and flip flop now. All right.
Well, actually, when you were saying all this, I was trying to remember. Was it that?
You're early listening.
No, well, I'm sorry. I thought I was. No, it made me think about. A similar situation when I was on my clerkships in terms of seeing my first X-lap and all that stuff. But I sort of wanted to do surgery ever since I wanted to do medicine. Part of it was because of my pediatrician. He was the same doctor who was there when I was born up until when he retired. I had the same doctor the whole time.
Everyone we've worked with takes the moral and ethical responsibility, their moral and ethical responsibility to the patients and to the patients' families, and to first do no harm. It's an oath that all doctors take. They take that responsibility very, very seriously, to a person. That said, bad outcomes happen and people die. Whether it is the responsibility of the doctor or not, it's a fact of life that people die, and it takes a certain type of person to be able to work with and connect to people in that way.